Can men get breast cancer too? You might think breast cancer only affects women, but men can get it too. Although it's much less common in men, it is a real health concern. Male breast cancer makes up less than 1% of all breast cancer cases worldwide. The chance for a man to develop breast cancer in his lifetime is about 1 in 700 to 1 in 1,000. That's roughly 100 times less likely than women, who have about a 1 in 8 chance. Over recent decades, the number of cases in men has been slowly increasing. For example, worldwide, cases more than doubled between 1990 and 2021. In 2021, nearly 20,000 men aged 15 to 64 were diagnosed globally. In the United States, it is estimated that about 2,800 new cases of invasive breast cancer will be diagnosed in men in 2025, with around 510 deaths expected. Men are often diagnosed later than women because breast cancer is less expected in men. Symptoms like lumps, nipple changes, or skin changes might be ignored or overlooked. The average age at diagnosis for men is around 67 years, which is a bit older than the average age for women, about 62. Certain factors can increase a man's risk of developing breast cancer. These include genetic mutations like BRCA1 and BRCA2, which are also linked to breast cancer in women. A family history of breast cancer, exposure to radiation, hormonal imbalances, obesity, and lifestyle choices such as high red meat consumption or secondhand smoke exposure can also play a role. Men with these risk factors should talk to their healthcare providers. They might recommend genetic counseling or closer health monitoring to catch any issues early. Since routine screening for breast cancer isn't usually recommended for men, it's important to pay attention to any new lumps, nipple changes, or other breast symptoms. If you notice anything unusual, seeing a healthcare professional promptly can lead to earlier diagnosis and better treatment outcomes. Treatment for male breast cancer generally follows the same approaches used in women. This can include surgery to remove the tumor, radiation therapy, chemotherapy, hormone therapy, or targeted treatments. When diagnosed early, survival rates for men are similar to those for women. But if diagnosis is delayed, outcomes can be worse. In summary, although breast cancer in men is rare, it does happen. Being aware of the symptoms and risk factors is key to catching it early. Men who notice changes in their breast tissue or have a family history of breast cancer should seek medical advice without delay. Remember, early detection can make a big difference in treatment success. Always consult healthcare professionals for personalized guidance and care.